Phenylethylamine enhances working memory. It improves executive function. It increases creative flow states. It has stress reduction properties. It gives you a better mood. It has anti-anxiety effects, and it lessens the symptoms of ADHD. It's a trace amino acid. Your brain naturally converts L-phenylalanine into phenylethylamine, or PEA as it's known. The most famous promoter of phenylethylamine was Dr. Alexander Shulgin and his wife Anna. He published a book, Phenethylamines I've Known and Loved, a chemical love story, in 1991. The phenethylamines are a group of derivatives and they contain the PEA structure as a backbone. These derivative compounds are formed by replacing one or more of the hydrogen atoms in the core of the structure. The class of PEA compounds includes amphetamines, empathogens, stimulants, psychedelics, appetite suppressants, bronchodilators, nasal decongestants, and antidepressants. One of the more famous PEA derivatives is MDMA, or ecstasy. Dr. Shulgin developed, tested, and published the formula for 179 different compounds largely based on the PEA structure in the book Phenethylamines I've Known and Loved. PEA activates the TAAR1 and AAR2 receptors, which in turn prevents the uptake, and it boosts the release of the feel-good neurotransmitters serotonin and dopamine. Monoamine oxidase inhibits the catecholamines like dopamine and norepinephrine. Decreases in dopamine levels are implicated in diseases like Parkinson's, and PEA helps to boost dopamine and norepinephrine levels, reducing the symptoms of neurodegenerative diseases. PEA prevents the reuptake of dopamine and norepinephrine, and it inhibits their transport. Like the mechanism of action provided by ADHD stimulant medication. Some have found supplementing with PEA as a nootropic has decreased their symptoms of ADHD. Phenylethylamine is a trace amine, and it's naturally synthesized from L-phenylalanine in the brain. Aromatic amino acid decarboxylase converts phenylalanine to phenylethylamine. This is the same enzyme that converts phenylalanine into dopamine, and it converts it at a rate comparable to the synthesis of the dopamine. But PEA is not retained in the neuronal vesicles like dopamine is stored. Instead, monoamine oxidase B quickly degrades the PEA. Despite its short half-life, PEA as a nootropic seems to be effective for increasing catecholamine activity by boosting dopamine and norepinephrine. PEA can be found naturally in many foods like cacao, algae, fungi and bacteria, as well as clover, beans, peas and some products like natto and eggs. PEA is also found in chocolate, where it's produced during cocoa's fermentation and the roasting process. It binds to C protein-coupled receptors TAR1 and 2. These are reserved specifically for trace amine use, and these receptors are not used by other major neurotransmitters like dopamine or norepinephrine. The half-life of PEA taken as a nootropic supplement is only 5 to 10 minutes, because it quickly is degraded by the monoamine oxidase B. Many users prolong the effects of PEA by using it with a monoamine oxidase B inhibitor like selegnine, horidine, or Avena sativa. PEA naturally boosts the feel-good neurotransmitters dopamine and serotonin, and studies have shown depressed patients, when tested, have lower levels of PEA. In fact, some suggest that a PEA deficit may be the cause of depression in the first place. One study had 14 patients with major depression take up to 60 milligrams per day of PEA, along with 100 milligrams of selegnine for up to 50 weeks. The researchers found the PEA produced sustained relief of depression in a significant number of the patients, including some who were unresponsive to the standard treatments. The PEA improves mood as rapidly as amphetamine, but it doesn't produce a tolerance. PEA is a mesencephalic enhancer, and this is defined as an enhancer-sensitive neuron in the brain that's capable of working in a split second on a high activity level due to an endogenous enhancer substance. This means the PEA stimulates the release of dopamine, norepinephrine and serotonin in the brain. But unlike stimulant drugs like amphetamine, which release a flood of these neurotransmitters in an uncontrolled manner, the PEA instead only increases the amount of the neurotransmitter that gets released when a neuron is stimulated by receiving an impulse from a neighboring neuron. In other words, the pattern of neurotransmitter release is not changed, but when the neuron would normally release a neurotransmitter, a larger than normal amount is released, and the result is nearly instantaneous improvement in cognitive performance, attention, awareness, pleasure, libido, and a sense of well-being. Phenylethylamine is an endogenous or a natural or built-in amphetamine. This mechanism of action of how prescription ADHD stimulants like Adderall work, and it's also the basis for many Schedule I drugs like MDMA, LSD, mescaline, and crystal methamphetamine. Phenylethylamine is naturally metabolized by monoamine oxidase B, but as we get older, MAOB levels rise and they suppress healthy levels of the PEA. Low PEA levels have been linked to several neurological diseases, and it can result in increased chances of ADHD, increased chance of addiction, energy levels declining, working memory and mood declining, contributing to Parkinson's disease. On the other hand, excess levels of PEA have been linked to migraines and paranoid schizophrenia. PEA quickly crosses the blood-brain barrier once you take it, and you feel its effects right away. Activation of the TAAR1 receptor inhibits the uptake, and it induces the release of dopamine, norepinephrine, and serotonin. It's like turning up the volume of neuron activity. A higher concentration of all these neurotransmitters increases feelings of pleasure. It boosts motivation, improves memory and cognition, and it reinforces impulse control. PEA naturally maintains and regulates neuronal activity, preventing over or under stimulation. When working as designed, PEA and other trace amines prevent metabolic dysfunction and neurological disorders. As a neurotransmitter, PEA acts like and looks similar to amphetamines, and it produces effects normally associated with taking stimulants. But unlike amphetamines, and because PEA is endogenous to the brain, side effects and tolerance are avoided. PEA works in an area of the brain that's associated with emotions, resulting in feelings of pleasure, more drive and impulse control, heightened creativity, and better sensory perception. PEA improves libido, social behavior, a sense of well-being, and better overall performance. PEA is currently being studied and used as a treatment for ADHD, depression, bipolar disorder, cognitive dysfunction like brain fog, and poor concentration. And PEA looks promising for treating addiction and eating disorders. PEA is rapidly broken down by monoamine oxidase B, so unless you stack the PEA with MAOB inhibitors, don't expect its effects to last. Most experience a peak within 15 minutes and sustained energy for 30 minutes to an hour afterwards. If you're ADHD or ADD, you should see an improvement in mood, attention span, focus, and mental clarity. Not quite the same effect you'd get from something like Adderall, but with a side benefit of more sociability. Users report taking an MAOI inhibitor and supplementing 15 minutes before the PEA dose. The effects could last for up to 2 hours then, and there's no crash like you'd normally experience with a stimulant, just a general feeling of well-being once it wears off. Some have reported PEA helped to kick the habit of phenibut or caffeine without going through withdrawals. As a pre-workout supplement, PEA provides a more intense and focused workout. Older users seem to feel even more benefit when using PEA, likely because monoamine oxidase levels overpower the dopamine as you get older, and using PEA, especially with an MAOI, helps to restore dopamine and other neurotransmitters that are typically depressed with age. PEA is a great nootropic for study because you should feel less anxiety, fewer panic attacks and less stress, and more motivation, a better mood, easier to maintain focus and have more energy. Some report food cravings subside and it's easier to lose weight. Depression is the second leading cause of disability among age 15 to 44. By 2030, the World Health Organization predicts depression will be the leading cause of disability worldwide. Selective serotonin reuptake inhibitors are the most popular antidepressants prescribed worldwide. The SSRIs work by blocking the serotonin transporter and inhibiting the reuptake of serotonin, resulting in an increase of serotonin in the synapses. The problem is SSRIs are slow to act and they come with a host of side effects. PEA may be a better alternative to the SSRIs. A study done in 2008 showed that PEA alters serotonin transporters by interacting with the TTAR receptors, increasing serotonin levels by preventing their reuptake, just like prescription SSRIs. The study suggested that PEA may be a safer treatment for depression. The diagnosis of ADHD has traditionally been done by analysis of symptoms, but measuring PEA levels instead has recently been described as a possible biomarker for diagnosing the ADHD. This discovery of a relationship between PEA levels and ADHD has excited researchers because it will hopefully improve the levels of confidence during the ADHD diagnosis and reduce misdiagnosis and over-medication. One study of ADHD children medicated with methylphenidate or Ritalin had significantly higher PEA levels when using methylphenidate. The PEA binds to the TAR1 receptor, and this alters monoamine transport function, and it leads to the inhibition of the reuptake of dopamine, serotonin, and norepinephrine, which then increases the concentration of these neurotransmitters in the neuron synapses. This increase in synaptic concentration of dopamine can be accomplished by directly blocking the dopamine receptor, which is how drugs like methylphenidate work to boost the dopamine. So if you're an ADHD patient and you crave chocolate, it's likely because this supplies PEA. Some naturopaths are beginning to prescribe PEA instead of stimulants like amphetamines or methylphenidate to help to treat ADHD. The PEA suggested dose for cognitive benefits is 500 mg up to 3 times per day. It has a half-life of 5 to 10 minutes, but the effects can be extended by using it with an MAO-B inhibitor. If you do use a potent MAOI, like selegnine, make sure to keep your dose low, for example 2.5 mg, or you're in danger of inhibiting MAOA also. Dosing more than recommended is not a good idea because you'll likely feel jittery, irritable, get a headache, feel nausea, and very possibly force your heart rate to a dangerous level. Cheese effect. PEA is metabolized by the enzyme MAOB, and when monoamine oxidase is inhibited by eating cheese or any other prescription or natural MAO inhibitor, the combination can result in a potentially dangerous increase in blood pressure. Studies show selective MAOB inhibition does not produce the cheese effect. Examples of MAOB selective inhibitors include low-dose selegnine, hordenine, oat straw or Avena sativa, Chinese licorice root extract. Do not use PEA if you're using prescription MAOIs like Marplan, Nardil, Azalect, Parnate, or if you've used one in the last 2 weeks. Do not use PEA if you have phenylketonuria. Too much PEA can cause irritability, nausea, amplified heart rate, jitteriness, and could be extremely dangerous. Remember, PEA is an endogenous natural amphetamine, and used irresponsibly could produce the same dangerous side effects as anything else in the amphetamine class of compounds. Your body does synthesize some PEA from phenylethylamine, which comes from food like beans, cocoa, peas, natto, and eggs. But most of us don't get enough PEA from our diet, so supplementing could help. The PEA is highly bioavailable and it quickly crosses the blood-brain barrier, so you should feel its effects soon after you take it. PEA is helpful for most users to combat anxiety, stress, and sleep deprivation. It'll boost dopamine, norepinephrine, and serotonin levels. It's particularly helpful if you take the PEA prior to a stressful situation, a workout, or physically demanding job. It's also great for studying. PEA could be helpful for people dealing with ADHD and ADD. It's a possible substitute to stimulant medication like Ritalin or Adderall. PEA will provide the dopamine that your brain needs, and it doesn't produce the stimulant crash when it wears off. PEA works well when taken with N-acetyl L-tyrosine for dopamine production and Alcar for acetylcholine. PEA is quickly degraded by monoamine oxidase B, so to prolong its effects it can be stacked with a low-dose MAOI-B inhibitor. For more information about herbs, supplements and natural treatment plans, check out my website.